Youth, teenagers, students. This group is the principal focus of an epidemic of venereal disease. Syphilis and gonorrhea. The two major venereal diseases are spread by sexual contact and nearly as old as man himself. An epidemic of syphilis, similar to today's, swept Europe at about the time of Columbus. Each country blamed the other. The Portuguese called it the Spanish disease, the Spanish called it the French disease, while the French called it the disease of Naples. Syphilis spread quickly, crippling and eventually killing many thousands. It was called the Great Pox, as distinct from smallpox, another crippling and fatal disease. All segments of society were affected, king and commoner alike. King Henry VIII of England was infected and passed syphilis to his daughter and two sons, the next three English monarchs. In 1905, two German scientists identified the cause of syphilis, a particular microscopic organism with a distinctive spiral shape. Microbes with this spiral corkscrew shape are called spirochetes. The spirochete of syphilis was given the name Treponema pallida. Pallida because it remained pale or pallid when covered by an identifying stain. The syphilis spirochete is transmitted from one human to the other by direct contact, generally involving sexual relations. Transferal is usually on the sexual parts, although other areas may occasionally be affected. Within 3 weeks of contact, an almost painless open sore develops. It is called a chancre and is filled with the spirochetes of syphilis. As long as the chancre remains, syphilis can be transmitted to other people if sexual or other intimate contact occurs. Within a week or two, the chancre heals, and the spirochetes pass into the victim's bloodstream and to other body tissues. As the body's defenses mobilize to fight this spirochete invasion, special antibodies are formed. Blood tests for syphilis, such as the Wassermann and VDRL tests, depend upon the detection of these special antibodies. Several weeks after the chancre has healed and as the antibodies increase, an allergic reaction of the body produces a syphilitic skin rash. This rash, called secondary syphilis, is usually widespread. It may involve the moist membranes of the mouth and sexual areas, as well as the palms of the hands and soles of the feet. The rash contains thousands of spirochetes, making it extremely contagious to any kind of contact. The rash disappears in a week or two, and the disease enters a long, quiet, or latent period during which the victim enjoys normal health. However, during the next 10 or 20 years, the spirochetes may attack many vital body organs. The attack may be centered on the brain or spinal cord, leading to insanity, paralysis, blindness, and death. Or the major attack may be on the heart or blood vessels, causing damage which first cripples and then kills. Still other victims of late syphilis suffer extensive, permanent destruction of their bones and joints. In the United States, between 1,200 and 12,000 people die each year as a result of syphilis, which was either treated too late or not at all. Congenital syphilis threatens the unborn child. Spirochetes of a syphilitic mother infect her fetus and may cause a stillbirth. Or the child may be born with a variety of serious defects, including blindness, deformed joints, and facial bones. Even if the baby appears to be normal at birth, its body will contain spirochetes capable of producing syphilitic damage in childhood or in later life. To prevent congenital syphilis, nearly every state requires blood tests for syphilis before marriage and early in each pregnancy. The first effective treatment for syphilis was a compound of arsenic developed in 1910 by Dr. Paul Ehrlich. This discovery came after 605 failures and was triumphantly named 606. But arsenic, as well as later medications containing mercury, lead, and bismuth, required years of painful treatment with no certainty of a lasting cure. With the discovery of penicillin therapy, it appeared that mankind could at last rid himself of the great pox, syphilis. Penicillin performed miracles, providing a rapid, safe, and certain cure for early infection, and halting the further damage and destruction of late syphilis. While penicillin can arrest the disease process in any individual, syphilis cannot be wiped out unless every case is found and treated. Early syphilis can be difficult to diagnose, particularly in women, because the chancre may be concealed in the internal sex organs. Because of this, the disease can be spread to others before it is detected. Therefore, as soon as a syphilitic case is discovered, it is mandatory that all other persons having recent intimate contact with the patient be examined for evidence of the disease. Examination and proper treatment are essential, not only for the person infected, but for all other possible contacts as well. Only by finding and curing each case before it is spread can the epidemic be stopped. In the past, nearly all patients were treated in public health clinics where trained investigators traced all known sex partners. With the advent of penicillin, which could be administered by the private physician, the need for clinic services was greatly reduced. This certain treatment sharply reduced the number of syphilis victims to an all-time low. As the number of new cases dwindled, money being spent on public health education and venereal disease control was diverted elsewhere. Many doctors, health officers, and government officials were confident that syphilis had been conquered, but it had not. Once again, all over the country, alarming increases are being reported, especially among young people. Once again, we are seeing that only by adequate treatment, continuing education, and the tracing of all other sex partners can syphilis be conquered. The story is similar for the second major venereal disease, gonorrhea. This disease, too, was nearly eliminated by penicillin. Everyone thought the battle had been won. Gonorrhea is caused by a small bacteria, the gonococcus, which is always found in pairs. It can live within the reproductive organs of both males and females and can easily be transmitted by intimate sexual contact. The first sign of infection in a newly infected male is a painful, pus-like discharge from the penis. If not treated at this time, the infection often spreads to the other reproductive organs, causing great pain and temporary disability. This may result in permanent scars which can cause urinary problems and sometimes sterility. In the female, the disease first attacks the vagina and its surrounding glands, then may extend to the lining of the womb. If untreated, the infection may progress to all pelvic organs, producing abscesses and extensive scars. Also, the ability to have children may be lost. 20% of the females newly infected with gonorrhea will notice an increase in discharge, and if the urethra is infected, a burning sensation during urination. But the other 80% will have few or no symptoms at all, and the disease may be completely overlooked. Such cases, when not treated, often infect other males and spread the disease widely. Because females may have the disease without symptoms, it is critical that all partners of a patient with gonorrhea see their doctor immediately, regardless of any evidence of symptoms. In both females and males, diagnosis is made by discovering gonococci in a discharge or in other secretions from the sexual organs. Although gonorrhea does not cause death or deformity in children, it may be transmitted to the infant as it passes through the birth canal of the mother. If so, it may attack the baby's eyes and cause blindness. To prevent this damage, most states now require eye drops for each newborn infant to destroy any gonococci that may be present. Gonorrhea can usually be cured with penicillin. Recently, some cases have become resistant to penicillin, so that other antibiotics must be used. Like syphilis, gonorrhea has not been eliminated by penicillin. One reason is that the gonococcus has become resistant to penicillin and newer antibiotics. Another reason is that not every individual who develops early symptoms receives adequate diagnosis and prompt treatment. The public must fully understand the importance of these examinations and be secure in knowing that venereal disease investigations always remain strictly confidential. The growing epidemic of venereal disease, which now affects hundreds of thousands of young people, can only be stopped if each case is treated before the infection is passed on. Drugs and doctors alone cannot prevent venereal disease. The cooperation of all citizens is essential. Spread the word. Help to stop the spread of venereal disease.